Welcome to our channel Yoga Glow, dedicated to your daily dose of yoga. In this video, we present a 25-minute yoga practice designed to fit seamlessly into your busy day, offering a rejuvenating blend of movement, breath, and mindfulness. Whether you're a seasoned yogi or just starting your journey, join us as we embark on a holistic exploration of body and mind. Let's carve out this time together to cultivate strength, flexibility, and inner peace. Let's begin. We are going to start with neck movements. There are 4 types of neck movement. Let's begin with forward and backward bending. Stand with the feet 2 to 3 inches apart. Keep the hands straight beside the body. Keep your palms on the waist. While exhaling, move the head forward slowly and try to touch the chin to the chest. While inhaling, move the head up and bend back comfortably. Now we will do right and left bending stretching. While exhaling, bend the head slowly to the right. Bring the ear as close as possible to the shoulder without raising the shoulder. While inhaling, bring the head to the normal position. Similarly, while exhaling, bend the head to the left side. Inhale and bring the head up to normal position. Next is right-left twisting. Exhaling, gently turn the head to the right so that the chin is in line with the shoulder. While inhaling, bring the head to the normal position. Similarly, while exhaling, turn the head to the left. Inhale and bring the head to the normal position. Last pose is neck rotation. Exhale, bend the head forward to touch the chin to the chest. Inhale, slowly rotate the head clockwise in a circular motion. Exhale while coming down. Do a full rotation. Then rotate the head in the anti-clockwise direction. Inhale, go back and exhale, come down. Come back, relax. Now we will do the shoulder movement. Keep the feet together, the body straight and the arms by the sides. While inhaling, raise both arms sideways above the head with the palm outward. Exhale and bring it down in the same manner. Palms must be open with fingers together. Place the fingers of left hand on the left shoulder and the fingers of right hand on the right shoulder. Full rotation of the elbows in a circular manner. Inhale and raise the elbows and bring them back while exhaling. Try to touch the elbows in front of the chest on the forward movement. Stretch the elbows back in the backward movement and touch the side of the trunk while coming down. Do the same in reverse manner. Inhale while raising the elbows and exhale while bringing them down. Benefits: it makes the bones, muscles and nerves of the neck and shoulder healthy. These practices are helpful in cervical spondylosis and frozen shoulder. Our next pose is trunk movement. Keep the legs about 1 foot apart. Raise both the arms up to shoulder level with palms facing each other and keep them parallel. While exhaling, twist the body towards the left side so that the right palm touches the left shoulder. Come back with inhalation. While exhaling, twist the body towards the right side so that the left palm touches the right shoulder. Come back with inhalation. Perform it slowly with coordination of breathing. Cardiac patients shall do with care. Avoid this practice in case of severe back pain, vertebral and intervertebral disc disorders, and during menstruation. Our next pose is knee movement. Inhale, lift the arms up to the shoulder level, palms facing downwards. Exhale, bend the knees and bring down the body to the semi-squatting position. In the final position, both the arms and thighs should be parallel to the ground. Inhale and straighten the body. It helps to strengthen knees and hip joints. Avoid this asana in case of acute conditions of arthritis. Next pose is mountain pose. Stand with feet 2 inches apart. Inhale, lift your arms up to the shoulder level in the front. Interlock the fingers and turn the wrist outwards. Now inhale, raise the arms up above your head. Raise the heels off the floor and balance on the toes as you raise your arms. Stay in this position for 10 to 30 seconds and breathe normally. Bring the heels down on exhale. Release the interlock of the fingers and bring the arms down and come back to standing posture. Benefits: this pose brings stability in the body, helps to clear up congestion of the spinal nerves, and corrects faulty posture. Caution: avoid lifting the heels in case of arthritis, varicose veins and vertigo. Next is tree pose. Stand with feet 2 inches apart. Focus on a point in front. Exhale, hold. Bend the right leg and place the right foot on the inner side of the left thigh. The heel should be touching the perineum region. Inhale and extend the arms up and join the palms together. Stay in the position for 10 to 30 seconds and breathe normally. Exhale and bring the arms down. Release the right leg and bring it to the initial position. Repeat this asana from the left side also. Benefits: this pose helps to improve neuromuscular coordination, balance, endurance, alertness, and concentration. Caution: avoid this practice in case of arthritis and vertigo. Next is half wheel posture. Stand straight with feet 2 inches apart. Support the back at the sides of the waist with the fingers. Try to keep the elbows parallel. Inhale, drop the head backwards, feel the stretch in the neck. As you exhale, bend backwards from the lumbar region. Maintain this final posture for 10 to 30 seconds and breathe normally. Inhale and slowly come up. Benefits: this pose makes the spine flexible and strengthens spinal nerves and muscles. It helps in the management of cervical spondylosis. Caution: avoid this posture if you have vertigo or a tendency to fall over or stylokides. Next is hand to feet posture. Stand straight with feet 2 inches apart. Inhale slowly and raise the arms up. Stretch up the body from the waist. Exhale and bend forward until both palms rest on the ground. Stretch the back to make it as straight as possible. Maintain this final posture for 10 to 30 seconds and breathe normally. Now inhale, come up slowly to the upright position and stretch the arms straight above the head. Exhale, slowly return to the starting position in the reverse order. Benefits: this pose makes the spine flexible, improves digestion, and helps in overcoming menstrual problems. Caution: avoid this practice in case of cardiac disorders, vertebral and disc disorders, abdominal inflammation, hernia and ulcers, glaucoma, myopia, and vertigo. Please note that those who are suffering with stiff back should bend according to their capacity. Next pose is triangle posture. Stand with feet 3 feet apart. Inhale slowly while raising both the arms sideways up to shoulder level. Turn the right foot towards right side. Exhale, slowly bend to the right side and place the right hand fingers just behind the right foot. The left arm should be straight in line with the right arm. Turn the head and gaze at the tip of the left middle finger. Remain in the posture for 10 to 30 seconds with normal breathing. Inhale, slowly come up. Repeat the same procedure from the left side. Benefits: this pose makes the spine flexible, strengthens calf, thigh and waist muscles, and improves the capacity of lungs. Caution: avoid this posture if you have slipped disc or sciatica. Avoid this posture after undergoing an abdominal surgery. Do not try beyond limits and overdo the lateral stretch. If you cannot touch the feet, you can reach for the knees instead. Next is butterfly posture. Sit straight with legs stretched out in the front. Keep the hands beside the hips and palms resting on the floor. Now put the soles of your feet together. Exhale and clasp your hands together over your toes. Inhale, pull your heels as close as possible up to perineum region. Stay in this position for 10 to 30 seconds with normal breathing. Benefits: this pose helps to keep the body firm and stabilize the mind. Helps during pregnancy and relieves abdominal pain often experienced during menstruation. Caution: avoid this practice in case of severe arthritis and sciatica. If your thighs are not touching or are not close to the floor, place a soft cushion underneath the knees for support. Next is Thunderbolt posture. Sit with extended legs together, hands by the side of the body, palm resting on the ground, fingers pointing forward. Fold the right leg at the knee and place the foot under the right buttock. Similarly, fold the left leg and place the left foot under the left buttock. Place both the heels such that the big toes touch each other. Position of the buttocks is in the space between the heels. Keep both hands on knees respectively. Keep the spine erect, gaze in front or close the eyes. Remain in the posture for 10 to 30 seconds with normal breathing. Benefits: this pose is good for digestion and strengthens the thigh and calf muscles. Caution: persons suffering from piles should not practice this pose. Those who are suffering from knee pain and ankle injury should avoid this practice. Next pose is half camel posture. Stand on your knees. Place the hands on the hips with fingers pointing downwards. Keep the elbows and shoulders parallel. Inhale and bend the head back and stretch the neck muscles. Exhale and bend the trunk backwards as much as possible. Keep the thighs perpendicular to the ground. Remain in the posture for 10 to 30 seconds with normal breathing. Return with inhalation. Benefits: this posture strengthens the back and neck muscles. It relieves constipation and back pain. It increases blood circulation to the head and cardiac regions. Caution: avoid doing this posture in case of hernia and abdominal injuries, arthritis and vertigo. Next is camel posture. Sit in Thunderbolt posture. Bring the knees and the feet a few inches apart and stand on your knees. While inhaling, bend backwards with the right palm on right heel and the left palm on left heel. Exhale. Be careful not to jerk the neck while bending backwards. In the final position, the thighs will be vertical to the floor and head tilted backwards. The weight of the body should be evenly distributed on the arms and legs. Remain in the posture for 10 to 30 seconds with normal breathing. Return with inhalation. Benefits: this posture is extremely useful for defective eyesight. It is useful in relieving back and neck pain. It helps to reduce fat over the abdomen and hip. It is helpful in digestive problems and cardiorespiratory disorders. Caution: persons suffering from heart diseases or hernia should not practice it. Next is child pose. Sit in Thunderbolt pose. Spread both the knees wide apart. Keep the big toes touching. Inhale, keep the palms between the knees. Exhale, bend forward with arms outstretched and place the chin on the ground. Keep the arms parallel. Maintain the posture for 10 to 30 seconds and breathe normally. Benefits: this pose helps to reduce stress and anxiety. It tones up reproductive organs. relieves constipation, improves digestion, and helps to relieve back pain. Caution: patients with osteoarthritis of the knees and acute backache should avoid this posture. Next is frog posture. Sit in thunderbolt pose. Spread both the knees wide apart while big toes touching each other. Raise your right arm, fold it from the elbow, and take it backwards above the left shoulder and place the palm on the left shoulder blade. Now fold the left arm similarly and place the palm on the right shoulder blade. Maintain the position for 10 to 30 seconds with normal breathing. Then come back slowly in the reverse order. While returning to the starting position, bend a little the right side, take out the left leg and extend it. Similarly, extend the right leg and sit with extended legs together. Benefits: this pose is helpful in relieving back and neck pain, especially cervical pain. It improves the diaphragmatic movements and lungs capacity. Caution: person with severe knee joint pain should avoid this practice. Next is half lord fishes pose. Our next pose is half lord of the fishes pose. Begin seated with your legs extended in front of you. Bend your right knee and place your right foot outside of your left thigh near your left hip. Cross your left foot over your right thigh, planting it flat on the mat. Inhale, lengthen your spine, then exhale, twist to the right, placing your left hand on the mat behind you. Hook your right elbow outside of your left knee, using it as leverage to deepen the twist. Gently rotate your head and gaze over your right shoulder, maintaining length in your spine. Hold the pose for 20 to 30 seconds, breathing deeply. Half lord of the fishes pose improves digestion, relieves back pain, and stimulates the organs. Practice regularly to enhance spinal mobility and promote overall well-being. Repeat the same pose with left knee bend. It removes the disorders of respiratory system such as asthma. It strengthens the spinal column and the muscles of the back. It is also effective for ailments of the throat like tonsillar diseases. This asana stimulates gastric secretions, very effective for patients who are suffering from diabetes. Caution: pregnant ladies are not advised to perform this asana. Next is crocodile posture. In this posture, the body would resemble crocodile, hence this name. Lie down on stomach with the feet wide apart, toes pointing outwards. Bend both the arms and place the right palm on the left palm. Place the head either the left side or the right side on your hands. Keep the eyes closed and relax the whole body. Benefits: this pose promotes relaxation of the whole body. It helps in the recovery of back problems. Caution: avoid this practice in case of pregnancy and frozen shoulders. This pose is practiced for relaxation in all prone postures. Next is cobra posture. Lie down on your stomach, rest your head on your hands and relax the body. In this posture, the body is raised like the hood of a snake, hence the name. Now join your legs and stretch your arms. Keep the forehead on the ground. Now place your hands just beside the body. Keep the palms and elbows on the ground. As you inhale slowly, lift the head and chest up to the navel region without changing the position of hands. Stay there comfortably. Now come back and place your forehead on the ground. Keep your palms beside the chest and raise your elbows from where they are. Inhale. Slowly lift the head and the chest up to the navel region. Keep the elbows parallel and maintain the posture for 10 to 30 seconds with normal breathing. Exhale, rest your forehead on the ground, come back and relax. Benefits: this posture: abdominal fat, relieves stress and constipation, and reduces it helps to relieve backache and bronchial problems. Please note that who have undergone abdominal surgery should avoid this posture for 2 to 3 months. and those who are suffering from hernia should not practice this posture. Next is locust posture. The locust posture, lie down on stomach in crocodile posture. Rest the chin on the floor. Keep both hands beside the body, palms facing downwards. Inhale, raise the legs off the floor as per one's capacity without bending the knees. Extend the arms and the legs well to ease, lifting the body off the floor. Stay in this position for 10 to 30 seconds with normal breathing. Exhale, bring the legs down towards the floor. Benefits: this posture relieves in sciatica pain and lower back ache. It helps to reduce fat in the thighs and buttocks and is also good in weight management. It helps to improve the capacity of lungs. Caution: one should proceed cautiously in case of severe lower back pain. People with high blood pressure, peptic ulcer or hernia should avoid this posture. Next is the bridge posture. Bend both the legs at the knees and bring the heels near the buttocks. While holding both the ankles firmly, keep the knees and feet in one straight line. Inhale, slowly raise your buttocks and trunk up as much as you can to form a bridge. Remain in this position for 10 to 30 seconds with normal breathing. Exhale, slowly return to the original position and relax. Benefits: it relieves depression and anxiety and also strengthens the lower back muscles. It stretches abdominal organs, improves digestion and helps to relieve constipation. Caution: people suffering from ulcer, hernia, etc. should not practice this posture. Next is raised feet posture. In this posture, lie comfortably on the ground with the legs stretched out. Hands should be placed by the sides. While inhaling, slowly raise both the legs without bending them at the knees and bring them to 30-degree angle with the ground. Maintain the position for 10 to 30 seconds with normal breathing. Exhale, slowly bring both the legs down and place them on the ground. Benefits: this posture helps in balancing the navel center. It is helpful in relieving abdominal pain, flatulence, indigestion and diarrhea. It strengthens the abdominal and pelvic floor muscles. It is effective in overcoming depression and anxiety. Caution: people with hypertension and back pain shall practice it with one leg alternatively without holding the breath. Next is half plough posture. Take supine position. Keep the hands beside the body and the palms resting on the ground. Inhale, slowly raise your legs together without bending knees and bring them up to a 90-degree angle with the ground. The body from hips to shoulders should be kept straight. Maintain this position comfortably for 10 to 30 seconds with normal breathing. Exhale, slowly bring the legs down to the ground without lifting the head. Benefits: this pose relieves constipation and is beneficial for hypertensive patients. However, it needs to be practiced under supervision. Caution: those who have lumbosacral lower back pain should not perform with both the legs together. Avoid this practice in case of abdominal injuries, hernia, etc. Next is wind releasing posture. Lie down flat on the back. Bend both the knees. Exhale, bring both the knees towards the chest. Inhale, interlock the fingers and clasp the shin below the knees. Exhale, raise the head till your chin nose touches the knees and relax. Maintain the position for 10 to 30 seconds with normal breathing. Bring the head back to the ground. While exhaling, bring the legs back to the floor. Benefits: it removes constipation, gives relief from flatulence, decreases the bloating sensation in the abdomen, and aids digestion. It generates deep internal pressure and improves stretching of the highly complicated network of muscles, ligaments, and tendons in the pelvic and waist regions. It tones up the back muscles and spinal nerves. Caution: avoid this practice in case of abdominal injuries, hernia, sciatica, severe back pain, and during pregnancy. Next is corpse pose. Lie down on back with arms and legs comfortably apart, palms facing upwards, eyes closed. Relax the whole body consciously. Become aware of natural breath and allow it to become slow and shallow. Remain in the position till you feel refreshed and relaxed. Benefits: this posture helps to relieve all kinds of tension and gives rest to both body and mind. The mind, which is constantly attracted to the outer world, takes a U-turn and moves inwards, thus gradually getting absorbed. As the mind turns quiet and absorbed, the practitioner remains undisturbed by the external environment. It is found beneficial in the management of stress and its consequences. Thank you for practicing yoga with us today. We hope this session left you feeling refreshed and centered. If you enjoyed this video, please consider giving it a thumbs up, sharing it with your friends, and subscribing to our channel for more yoga content.